Today our topic is Cri Du Chat Syndrome, Cat's Cry Syndrome, 5P Syndrome, Legion Syndrome. These are all the other names. A rare genetic disorder due to the missing part, that is deletion of the chromosome 5. It was first described by the Jerome Legion in 1963. It affects 1 in the 50,000 live birth, strikes all ethnicities. They are more common in the females by 4:3 ratio. Infants produce the high-pitched cry. They also carry many disabilities and abnormalities. Some are born with the serious organ defects or the complication that can result in death. Most fatal complications occur before the child's first birthday. Can Cri Du Chat syndrome be inherited? Most cases of the Cri Du Chat syndrome are not inherited. The deletion occurs most often as a random event. A high-pitched cry, abnormal larynx development and the CNS. Low birth weight, feeding problems, severe cognitive speech and the motor delays. They also have the behavioral problems. Small chin, unusually round face, small bridge of the nose, abnormally wide set eyes, ocular or the orbital hypertelorism, hypotonia, low set ears, short fingers, single palmar creases, cardiac defect, and the ventricular septal defect. These are all the common symptoms of Cri Du Chat syndrome. Other symptoms like mental retardation, dropped jaw, open mouth expression, malocclusion of the teeth, scoliosis, chronic medical problems, cleft lip and the palate. Diagnosis like at birth, they are based on the physical abnormalities and the displayed symptoms. X-ray on the head to detect the abnormalities in the base of skull. MRI, CT, echo, ECG. To confirm the diagnosis, a chromosome test often be performed. Fluorescence in the cytohybridization test, which is used for the diagnosis of the chromosome which was affected. And they also go for the differential diagnosis like Cri Du syndrome trisomy 13 and Wolff-Hirschman syndrome, partial deletion of the chromosome 4. Treatment is no cure for the disease is available for the Cri Du Chat syndrome. They can give speech therapy, behavior modification programs and surgical treatment like a cleft palate, congenital heart problem. Prader-Willi syndrome, a rare genetic disorder, 7 genes on the chromosome 15, Q11 to 13 are deleted or unexpressed on the paternal chromosome. First described in 1956 in Swiss, 1 in the 10,000 of birth. Genetics chromosome 15, an individual without the Prader-Willi syndrome receives the chromosome 15 from the mother and another from the father. In Prader-Willi syndrome, there are 3 genetic subtypes: deletion, maternal disomy and the imprinting defect. When speaking about the deletion, which causes a 70% in a deletion including the Q12 band. The imprinted Q11 to Q13 is normally active on the father's chromosome 15 and inactive on the chromosome 15 inherited from the mother. Therefore, the paternally expressed genes from this region of the chromosome 15 are missing in the deleted gene of the chromosome 15 and the Prader-Willi syndrome occurs. Maternal disomy on the UPD 25% takes place. Both chromosome 15 are inherited from the mother and no chromosome 15 is present from the father. Missing chromosome 15 from the father, which contains the active genes required for the normal development. Third is imprinting defect. This is inherited from the father of the chromosome 15 involving Q11 to 13 region. Normal expression of the genes that are active on the chromosome 15 from the father is not allowed. Prader-Willi syndrome then occurs. Signs and symptoms generally occurs in 2 stages. One for the infants. Poor muscle tone, hypotonia, distinct facial features, failure to thrive, that is poor feeding, lack of eye coordination, strabismus, generally poor responsiveness, tired, slow response. Narrow temples, elongated face, thin upper lip and a prominent nose. The second stage signs and symptoms for the early childhood is food craving and weight gain, underdeveloped sex organs, poor growth and the physical development, learning disabilities, delayed poor development, speech problem, behavioral problems, and the scoliosis. Diagnosis: it is based on the complications that the child have and the clinical presentation, and they go for genetic testing. Treatment is no cure. Treatment is to lessen the symptoms, physiotherapy during the infancy, speech therapy, growth hormone therapy. They have the high pain tolerance, being unaware of the acute gastritis, cholecystitis, and hepatitis. Thank you.